Yes, hello everyone. This is Group 10 presenting, and my name is Sunday Emmanuel Ezekiel, and my group member is Mulindo Amak Miles. So basically, we are going to talk about the topic that was assigned to us, which is about the EEG and ECG signal processing. Yeah, so these are our details. Proceeding to the next slide, it indicates the contents for the slides that we shall be presenting, which is talking about the topical discussion and also differences and similarity, then also the implication in machine learning, then the applications, then the trade-offs, then the final remarks. So proceeding to the next slide, I'll be elaborating more on the electroencephalogram signal processing. Yeah, that's the ECG signal processing. So talking about the ECG signal processing, which involves analyzing and interpreting electrical activity in the brain, basically recorded through electrodes placed on the scalp. So to talk about it, this is a technology. This technology plays a crucial role in neuroscience, clinical diagnosis, diagnostics, and also the brain-computer interfaces, and also the cognitive research. Proceeding to the next part of the slide, which basically talks about, it usually is described by, okay, let me say the characteristics. It talks about the nature. What do I mean by that? The nature, the ECG signals are non-stationary, meaning their statistical properties change over time. So to elaborate more about this is that the signals are highly variable and influenced by both internal brain activity and external disturbances, that is the artifacts. Yes. So to proceed to the frequency bands basically talking about the what? The ECG signals are categorized into different frequency bands, each associated with specific brain states and functions. Yes, what do I mean by that? So there is the delta waves, which is between 0.5 to 4 hertz, which is found in deep sleep and unconscious states. Then there is the theta waves, which is basically associated with drowsiness and also meditation and early sleep stages. Then there is the alpha waves, which is indicative of a relaxed and awake state with closed eyes. Then there is the beta waves associated with active thinking, focus, and problem solving and conscious decision making. That's about the beta waves, which is between 13 to 30 hertz. Then there is the gamma waves, which is greater than 30 hertz, which is associated with high-level cognitive processing, perception, and consciousness. Yeah, that's basically about it. Then it's also linked to information processing and brain connectivity. So it's basically studied in relation to the gamma waves is basically studied in relation to neurosynchrony and learning processes. Then proceeding to the amplitude ranges from microvolts to millivolts. This one basically talks about low amplitude signals may indicate high cortical activities, while high amplitude waves are common in deep sleep. So to proceed to the next part, which talks about the noise. The noise, ECG are often contaminated with artifacts such as eye blinks, muscle activity, and power line interference. Yeah. So that's basically it, where it's contaminated by biological and environmental artifacts. Yeah. So proceeding to the next part that talks about the pre-processing. Yeah. So basically, the pre-processing. The signal pre-processing basically talks about this must be done to remove noise and artifacts while preserving the neural activity. Yes, so that's the reason why it should be done. So to extract what? To extract meaningful information from EEG data, various signal processing techniques are applied. So there is the pre-processing, which is categorized by filtering. So the filtering used to remove noise. Basically, that's what it does. Then the artifact removal. So techniques like independent component analysis and regression methods can help remove unwanted artifacts. So the next thing, which talks about the feature extraction, which is basically extracts useful characteristics such as power and spectral density, entropy, coherence, and wavelength coefficients. So the next part I'm going to talk about is the classification and machine learning. So basically, the classification and the machine learning, because I was talking about the feature extraction, let me just elaborate more about it. So basically, it extracts useful characteristics such as the power, spectral density, entropy, which I had said earlier on, and it's also used for application like brain state classification and neurological disorder detection. So to talk about the next slide, which basically talks about the ECG signal processing involving analyzing and interpreting electrical signals generated by the heart, which are recorded using electrodes placed on the skin. ECG signals are critical for diagnosing cardiovascular conditions and monitoring heart health. Yeah, so that's basically about that slide. I think it's understandable because it talks about it talks about the what? Proceeding to the next part of the slide, which talks about the nature. The nature to mean that ECG are quasi-periodic and also reflecting the heart's electrical activity during each cardiac cycle. Yes, that's basically the simple understanding of it. Then the key components are the P wave, then also the QRS complex, which is a ventricle depolarization, most prominent feature in that component. Then the T wave, which is a ventricular repolarization. Yes, so let me proceed to the next part, which talks about the frequency range, which is typically between 0.05 to 100 hertz. Yes, so proceed to the next part of the slide, which basically talks about the what? The next slide, which basically talks about the pre-processing. The pre-processing, which is usually, the ECG pre-processing are often contained by noise and artifacts, making processing a crucial step before further analysis. The goal is to remove unwanted interference while preserving meaningful neuroactivity data. So I'm going to talk about the filtering part of it, which filtering helps isolate relevant frequency components and eliminate noise. Yes, so in this slide, I talked about removes low frequency baseline, wonder less than 0.5 hertz, and high frequency noise greater than 40 hertz. But then basic understanding is that it helps isolate relevant frequency components. Then under it, we can maybe talk about the band pass filtering used to retain EEG frequency bands while removing very low and high frequencies that may cause noise. So to continue to the next part of it, which talks about the artifact removal. Artifacts are unwanted signals that distort EEG data. Common artifacts include eye blinks, muscle movements, and also power line interference. So the independent component analysis, which is the ICA, it's under the artifact removal, just some logic under it, which basically it's a blind source separation technique used to separate EEG signals from artifact components. Yes, then also identifies independent sources and allows removal of non-neural artifacts. Then maybe talk about the regression-based methods, which uses mathematical models to estimate and subtract artifacts from EEG signals. Then also maybe to talk about the what? Here it talks about, on the slide we mentioned normalization, scaling the signal amplitude for consistency. Yeah, so that's basically it. Then proceeding to the next part, of the slide, which basically talks about which basically talks about the picture extraction. It identifies key characteristics of the ECG signal for further analysis, which under the picture extraction, we shall mention the what? We shall mention features such as what? Okay, let me just say that the picture extraction is a crucial step in EEG signal processing, aiming to identify meaningful patterns, okay? So that represent different brain activities. These features can be used for medical diagnosis, brain-computer interfaces, cognitive research, and emotion recognition. To talk about the features that are under it, we shall mention the time domain features, which basically talks about the heart rate, the RR intervals, and also which is time between successive R peaks and QRS duration. Yes, so that's the time domain features, which is mainly extracted directly from the raw EEG signal without transforming it into the frequency domain. Yeah, basically they describe amplitude variation, statistical properties, and waveform characteristics over time. Yes, so let me proceed to the next part of the slide, which talks about the what? The morphological features. Morphological features are amplitudes and shape of P, QRS, and T waves. So to proceed to the frequency domain features, which basically it transforms EEG signals into different frequency components, revealing dominant brain rhythms associated with cognitive and mental states. So to proceed to it, under it, we can talk about the power spectral density, which is the PSD, which measures signal power in different frequency bands. Then also the Pasta-Fora transform, which converts EEG signals from time to frequency domain. Then the wavelet transform, which overcomes FFT's limitations by analyzing signals and at multiple scales. Then the time frequency features, which we shall talk about. These are non-stationary. Yeah? So that's to mean meaning their frequency components change over time. Yes, meaning that their time components change over time. So let me proceed to the next part of the slide, where we shall talk about the differences. Okay, we shall talk about the differences between the ECG and also the electroencephalogram and also the electrocardiogram. We shall talk about the difference between them. Yes, so basically the difference between two of them is that the electroencephalogram basically the difference between is that it's between 0.5 to 100 hertz, and also the electrocardiogram is between 0.05 to 150 hertz. Then the next part, which talks about the EMG and also the EMG and also the what? Okay, let me just re-echo more about the details of the nature of the ECG signals. The ECG signals repeat in cycles corresponding to heartbeats. Yeah, so That's how. Then also that another difference between them is that the spectral, it includes the spectral, spatial, temporal, and also then this other side includes the electrocardiogram, includes the morphological. That's the P, the QRS, the T waves, which I talked about in the previous slides. Yeah, so basically to mean, okay, the P wave, which I said represents anterior depolarization. Then the QRS, which I talked about, the most prominent feature indicating ventricular depolarization. Then the T wave, which I talked about, basically reflects ventricular repolarization. Yes. Then going to the next part, or maybe recalling on the first part, which I talked about, the ECG signals typically falls within 0.05 to 100 hertz. So most energy is concentrated between 0.5 to 40 hertz, making this range most relevant for what? For analysis. Then the amplitude, basically, the amplitude of the ECG basically ranges from 0.5 to 5 millivolts, depending on the heart's electrical activity. Yes. So let me proceed to the next part of the slide, which basically we shall talk about the what? Shall talk about the similarities between both of them. Yes, the similarities between both of them, which I think it's understandable. Yes, it's understandable. So the electroencephalogram basically does what? The electroencephalogram basically requires multiple electrodes. Basically requires multiple electrodes. Yes. So, and then also the electrocardiogram also requires what? Also requires multiple electrodes. Yeah. So what I'm trying to say is that both the EEG and the ECG use multiple electrodes to capture electrical activity. Yes. So, and also the EEG places electrodes on the skull to detect brain signals, while the ECG places them on the chest, arms, and legs to measure heart activity. Yes, so then the next part that talks about it measures and records electrical activity. And also this electrocardiogram also does the same, whereby EEG records the electrical signals generated by the neurons in the brain. And then the ECG records the electrical impulses produced by the heart's contraction and relaxation cycles. Then they're also non-invasive, meaning that both EEG and ECG are non-invasive procedures, meaning they do not require surgery or penetration of the skin. Then they also assist in diagnosing medical conditions, both of them. Reason being, they're used to diagnose neurological disorders like the epilepsy, sleep disorders, and brain injuries. Then they are also safe, reason being they do not use radiation, making them completely safe for repeated use. Yes, and also can be used continuously. Reason being both EEG and ECG can be used for continuous monitoring in hospitals, ICUs, and home-based settings. Yes, so let me proceed to the last part of the slide, which I'm going to talk about. It talks about the implication in machine learning, the EEG and the ECG. So basically, automated diagnosis and detection, whereby machine learning improves the accuracy and speed of interpreting EEG and ECG signals. Yes, so detects heart conditions, for example, heart attacks and neurological disorders, for example, epilepsy. Then the next part, which talks about the deep learning and the neural networks, whereby the AI models such as convolutional neural networks and recurrent neural networks detect hidden patterns in bioelectrical signals. Then the advanced signal processing, which is a feature extraction technique, whereby For example, the power spectral density, then also the noise reduction methods, filter, out, motion, anti-artifacts. Then the real-time monitoring and wearable tech, whereby the ML-powered wearable devices, for example, smartwatches, the ECG patches, allow continuous health tracking. Then I'll talk about the second last point talks about the increased diagnostic accuracy, which is ML models reduce human error by offering objective data-driven assessments, whereby it combines historical and real-time data for more precise medical predictions. Then the last point which I'll talk about is the proactive and preventive healthcare, whereby early disease detection allows timely medical intervention, reducing severe complications. And then maybe also it supports telemedicine, enabling remote diagnosis and personalized treatment plans. Then also helps in long-term health monitoring. Yeah, so in conclusion, machine learning is transforming medical diagnosis, making EEG and ECG interpretation faster, more accurate, and accessible. With real-time monitoring, deep learning, and advanced signal processing, AI-driven healthcare is leading to better patient outcomes and early disease prevention. Yes, thank you very much. This is where my presentation ends. And then let me invite the next speaker to take you all through the next slide, Melinda McMiles. Thank you. This is group 10. Thank you.
Good evening. I've already been introduced by my group mate, Mark Molindo, and I'll be starting from the applications of encephalogram, which is basically EEG. Now we have this in clinical diagnostics. Detecting epilepsy and sleep disorders, brain injuries, or any other neurologic monitoring anesthesia depths or coma states. So basically, EEG is well used in neurology to detect any diagnosis and diagnose, various brain-related disorders, and this could be an example of things like ADHD, which we're doing this, something we're doing ADHD. We're doing a study on ADHD and EEG. And epilepsy detection also as well as another example of clinical diagnostics, sleep disorders, brain injuries, and things like that. Then we could go to monitoring anesthesia. Yes, as another example. Still, yeah, monitoring anesthesia, coma states. Then we have brain-computer interfaces. These are for controlling the external devices' brain activity. So in such a modern era, we have so many modern things going on. And this has been an innovation of such things. The EEG data is helping us able to analyze the brain waves and then control a device for like disabled. So it allows individuals to control devices, for example, smartwatch, wheelchair, robotic arm, things like that. Then we have cognitive and behavior research, studying attention, memory, and attention. So this is used in psychology and neuroscience to study how people stay up to date with things, how they're keeping their attention read, things like that. It helps researchers to understand how the brain processes emotions, learning, and social interactions. Supports studies on mental workload and stress levels in different environments, e.g. pilots, drivers, students, things like that. Neurofeedback and training individuals to regulate their brain activity. So imagine someone knows what is going on in their brain. So maybe if they're overthinking something, they could be able, okay, now my brain knows they're going berserk right now. I should be able to like regulate this and try to keep it in check. Okay? Now that was electroencephalogram. This is electrocardiogram, like my group mate told you earlier. Electrocardiogram is more of in the chest. And then the former is more on the brain. all still dealing with electronic signals from the body. So like we said earlier, it's basically the same thing. Clinical diagnostics, the wearables, telemedicine, the research, except this could be in a different area. Going to be in a different area because of the different locations. Remember, our brain, then heart. So this is detecting arrhythmias, myocardial infarction, other cardiac conditions. Then wearables. So these days we have smartwatches, we have fitness trackers. These days, even our phones themselves can know the amount of paces you're taking as you walk. Telemedicine, remote monitoring of patients with chronic heart conditions, studying of cardiovascular psychology and the effects of drugs or exercise, that's in the research field. Same thing as the former, basically, because it's all data, it's all electronic, just difference in application. And this was sort of to be a visual example of what's going on if, what's going on in these steps. So here on the left, we have the electroencephalogram. So they put like a bunch of small stickers on your head. Then those stickers transmit what they receive. So it's going to be something like this on the computer. My group might show that to you earlier. It's going to be something like this. Signals like that on the computer spiking wherever, regardless of whether they put it on the heart or the brain. So, and then remember when you get EEG signals, it's going to be noise, like I told you, artifacts. If you blink, says these stickers are going to pick that as a signal. If you twitch your ears, something like that. So maybe if you're doing ECG, you twitch your muscles, that's going to be picked up. So all those things are pre-processing, picture extraction, cleaning all the data, removing all the extra things. All that is going to be done in order to ensure that the ECG data we get is going to be all clear. Then this was meant to be sort of more the same thing. EEG signal processing, you can see here, flicker of the muscle noise, the eye blink. So let's get the idea. Then this was sort of to be a sample code. EEG data is, like I said, it's numerical values, like I told you. They are ranges earlier. And I also told you working on a project on ADHD. So in sort of this computing field, in something like this, you need data to train a model. It's like that. Now, EEG signal processing can be used to train a model, like you've seen here in my applications, to train a model and be able to detect neuro-related disorders or cardio-related disorders. So with this data, you could essentially study the patterns. For example, this is essentially it's a graph showing how the electrodes were placed on one's head when they were taking measurements of data. So maybe this could be like the frontal cortex here. This could be the back, the sides here around the ears, things like that. And this is sort of like a heat map. Imagine 0 to 18 showing the regions, things like that, where they lie from 0 to 18, FP1, FP2, F3, all the way up to PZ. Now this could help, this data essentially help us to train model to do something that could actually help the world and train a model to be able to diagnose ADHD or Alzheimer's disease, cardiac conditions, arrhythmias, the sleep disorder, the brain injuries, anything. As long as it can be gotten with electrical data, you'll be able to diagnose that essentially. So this is going to be an example of the code, how you essentially use this data. Now here, it's just for visualization. Get the data set, we plot the data, either a pair plot or a heat map. Now this is a heat map. this one here. Pair plot is just, you could plot different kinds of charts. 1, 2, 3 columns, whatever you want. Then go to the trade-offs of using electroencephalogram, ECG. Now, like I told you earlier, some of the disadvantages, EEG signals are weak and they're easily contaminated by noise. The artifacts I was saying earlier, the eye blinking, twitching of the muscle, individual variability. EEG patterns vary significantly across individuals. Yes, we're very different people. We've got different brains, different hearts. So the age, the gender, the medical history, even the mental state, all that determines which type of EEG patterns we're going to get out of you. Then spatial resolution. This is limited by a number and placement of electrodes. So you saw here, this placement of electrodes generates something. If you had more or less, it'd be the same thing. So EEG records brain activity at the scalp level, but it lacks a deep brain resolution. Unlike MRI or MEG, EEG cannot precisely locate neural activity inside the brain. Then interpretation. This, first of all, yes, this data, look at this data. Unless you have experience in this field, you literally can't interpret this just by looking at it. It requires expertise to distinguish between normal and abnormal activity. This EEG signals. Then electrocardiogram. This is now ECG. This is the heartbeat. The noise and artifacts again, the individual variability, real-time processing. Now, like I was telling you about the wearables and stuff, seeing your heartbeat, seeing your heart rate, knowing your oxygen level. Yes, I've seen smartwatches that give you the oxygen level. How do you think they do it? Now it's going to need processing. But to understand this data, interpretation again, this challenge comes again. Then for the final remarks, EEG and ECG aren't just about squiggly lines. They're not just a bunch of Z lines on the screen, but they are tools that can help us see the inner workings of our body in ways we never could before. EEG lets us speak into the brain's operation, while ECG helps us understand the heart's steady rhythm and the heartbeat. It's cleaning up noisy signals and finding meaningful patterns isn't easy, but it's how we turn raw data into real-world solutions, like helping someone control a robot arm with their thoughts or catch a heart problem before it becomes urgent. So imagine one's arm was amputated. If we could be able to capture the brain signals being portrayed when the person is thinking, movies, could be able to give the person a robotic arm and help him with the arm. Many people watched Kingsman, The Golden Circle. That would be a really nice example of something like this. And then as computing progresses in development, these tools will keep getting better, smaller and faster, and more when to our daily life. But let's not forget the human side. The goal isn't just fancy algorithms, it's giving not only doctors, health workers, normal people clearer insights, and patients healthier futures. Yeah, and then that was us for group 10. Thank you for having us in the ECG and EEG signal process. Good.